Hello, everybody. Let's talk about oral malodor, or otherwise known as bad breath. So what causes it? How does it happen? And how can we help our patients? So there are two separate things that you should know about this topic. And that is, it could actually be a systemic issue. So they might have the cleanest mouth ever, but if there's something going on that they're not happy with, it could be a systemic issue. So either acids systemically, or just something's going on that needs to be looked at by a doctor. Or, of course, there is something about the mouth that they're either not brushing twice a day, their oral hygiene isn't impeccable, maybe they're using the wrong mouthwash. There are a couple different things, and that's what I'm going to talk to you guys about. So I'm just pulling up my notes here so I don't forget anything. So basically, if your patient is bringing this up to you, they're concerned about it. So you don't just want to say, well, brush better and you'll be fine. Let them know this is such a common problem. And actually 90% of the time it is coming from the mouth. So it's not a systemic issue. But it's basically microorganisms on the tongue and the teeth. Often people forget about the tongue. If they're not cleaning the tongue, if they're not doing that, then this is how oral malodor can happen. But to be honest, I don't clean my tongue and I don't have any issues with that. But some people just need to go the extra step, right? You just never know. And it could also be caused by somebody who has a lack of saliva. Either because they're taking a lot of medications, or that's just the way they are, or they have some other condition that causes them to have a lack of saliva, which can cause oral malodor. Those are kind of the main things. So how do you talk to your patients about improving that? Make sure they are using their toothbrush every day, twice a day, and they're cleaning in between the teeth as well with something, whether it be a water pick, anything, just as long as they're cleaning in between the teeth every day, that will help. And take it a step above and use a mouthwash. That will also make a big difference. But then also tell them, if you are a smoker, you got to stop smoking. You can't, you're not going to have very good breath if you're a smoker. So that could be part of it. Smokers don't typically want to stop smoking, but let them know even if they reduce their smoking habit, that could help. Maybe they drink a lot of coffee. Caffeine can also cause that. But make sure to tell them, going back to oral hygiene, they might need to be cleaning their tongue twice a day. There are tongue cleaners, or they can even use their toothbrush. They could have a toothbrush specific for their tongue and then a toothbrush specific for their teeth, or they can use the toothbrush for their teeth and their tongue. It doesn't matter. They're all being cleaned the same way, in my opinion. But let them know not to forget their tongue. If lack of saliva is the issue, then that needs to be taken care of, either by using special mouthwash, mouthwashes, toothpaste, xylitol products. All of that can help. If it's something that has to do with allergies, so it could be a nose and throat issue, then the allergies need to be taken care of, but that can also play a big effect. So let them know there is hope for them, but you might have to try certain things before you try other things. Start simple, have them clean their mouth as much as possible. Tell them it's not going to solve the problem overnight, especially if, let's say, you're seeing a patient with severe perio. You can let them know you have bad breath because you have severe perio. You have a lot of gum issues happening that's causing the bad breath. After we clean the teeth and get things maintained, the bad breath is going to go away if that's the cause of it. But let them know it's not going to happen overnight. If they start to brush twice a day, it's not going to magically stop if they still have severe perio. But try things first. Have them maintain their oral hygiene. If that for some reason isn't working, they're doing everything they can, then maybe you need to incorporate a xylitol product. Maybe it's the foods they're eating. So kind of looking into things for them, because if the patients bring it up, they are concerned about it. Don't just kind of say, oh, okay, we'll brush better. We'll talk about it next time. They're probably embarrassed to bring it up. So just a couple things to help you and help them, and let them know you might have to try different things before you find something that works for them, because everybody's different. So let me know, you guys, if any questions, and I'll see you in the next one.